And I'm going to do a reintroduction for those of you that missed it. We have Emilie Sayler, and the name of her presentation is Assessing Nutrition Access Among Senior Residents of Madison County, Montana. And her site mentor is Hilary Hansen with the Montana Public Health Institute. So take it away, Emilie. Let's see if we can get her to go.
Thank you. Sorry, guys, that was so Monday. That was such a Monday thing to happen. And thank you, Lauren, for jumping in and being ready to go. I really appreciate that. So hello, my name is Emilie Sayler, and I am an MPH candidate with the University of Montana. I also work as the Public Health Director for Madison County, and I completed my APE project locally with Lee Taggart as my academic advisor and Hilary Hansen, Chief Operating Officer of the Montana Public Health Institute, as my site mentor. The topic of my APE project was assessing nutrition access among senior residents of Madison County, Montana. So what is a needs assessment? A couple of definitions are listed here, but in a nutshell, a needs assessment is the process of asking a population what they need, what they already have, and then compiling that into a report. The information can be collected in different ways, but we most commonly see written surveys, focus groups, key informant interviews, reviewing information from other reports, and asking stakeholders for input. I've assisted with coordinating some of these assessments when I worked in healthcare at a critical access hospital here locally, but we also always contracted someone to do the survey work and compile the reports and assess that data. And I wanted to do this project because I had a curiosity about how it is done and whether I could do this work myself in the future, which could save my community a lot of money. So that was really my driving force for wanting to do this. And why did I choose to do a one topic needs assessment? I did this because I found an old needs assessment that had been done in 2010 that identified access to fresh foods as one of our negative impacts in the rural community. And it made me think about some of our most vulnerable residents and how this might impact them. So I opted to focus on the topic of nutrition access, specifically for seniors, but I reached out to seniors throughout the entire county to gather as much input as I could. Shown here on this slide, you can see a picture of the Sheridan, Montana Senior Center. This building was the old clinic in town, but it was donated to the Senior Center and renovated in the past few years. The Senior Center reported serving up to 50 meals daily between in-house and Meals on Wheels deliveries through this building. Madison County, Montana is located in the southwest part of the state. We're between Dillon and Ennis and just south of Whitehall. We're a very rural county due to the amount of land here, but we have a low population density. Of the population, 29% of those are over the age 65. When you look at the part that says 1,200 miles of county roads, so that's not highways and that's not streets. Those are county dirt roads. You can imagine how remote some of our senior residents are. There are people who live here who are up to an hour away from the nearest grocery store, convenience store, or senior center. So if you look at the size of Madison County on that map and compare that to some of the larger population counties across the state, kind of gives you an idea about how remote our population really is. I conducted a survey of 10 simple questions at each of our 4 senior centers. I had 57 people willing to be surveyed, but one was excluded due to age. Unfortunately, he was too young. From these 56 participants, I gathered results and put those into a report that ended up being 15 pages. And I covered everything from the inclusion and exclusion criteria questions to the frequency folks grocery shop and how they travel to the store. See some of the information that's on this page. Are you able to access your preferred foods in the community? And how would you rate the affordability of fresh foods or fresh produce in your area? You can see that not very affordable was the most popular response to that question. And are you able to access your preferred foods in the community was interesting to me because some of the preferred foods were for reasons that were culturally or religiously related. This is the report cover and a short description of why nutrition is important for seniors. You can see here that it states that older adults need fewer calories than younger and middle-aged adults due to their physical activity level, changes in metabolism, and age-related loss of bone and muscle mass. This is also compounded by chronic illnesses that typically set in during our senior years, medications older folks take, and changes in body composition. The statement also suggests that a healthy diet is much more important for this group of people. The competencies covered with this project include the foundational competencies 2, 4, and 7. I also covered concentration-specific competencies 1 and 5. Combining these competencies, we gathered data and interpreted it to assess the needs of a specific population, while also focusing on a rule setting and analyzing problems associated with a population of low density. I did meet some barriers and challenges in this project. First, when I designed this assessment, I thought it would be easiest to meet people where they go. However, I realized as I was assembling my report that in doing this, I only included people who currently utilize available resources. So they wouldn't have the needs gaps to report that people who don't participate in senior center meals would have. I also attempted to survey people when they gathered for meals, and some didn't stay after they ate because they had somewhere else to be. It was a lot of work to cover so much ground. You can see that I logged a lot of miles to do this work. And some people gave me some guarded responses. I can't really evidence that in the survey itself or the report, but I have been as open as I would have liked because we didn't have a private area to survey people. And I think they maybe just shared answers similar to what their neighbors shared. To summarize the project, we can look to the data collected for question 6. Currently, 3 of our communities host farmers markets during the summer. The biggest one is in Twin Bridges, where a Hutterite farm brings vegetables, eggs, baked goods, and poultry each Saturday morning. People in Twin Bridges have tried to expand it into a year-round market, but the effort didn't take. I'm not sure what the reason is that it didn't work, but I think this could lead to some more research to find out why it didn't work and what changes could be made to make it successful. But you can see here the overwhelming majority response to question 6 regarding the seasonality of farmers markets or produce stand availability versus those not interested in the option indicates space for expanding this resource to include importing foods for off-season availability of the farmers market. The assessment yielded valuable information regarding the satisfaction of seniors in Madison County, Montana, when asked about the accessibility of fresh and nutritious foods within their communities. While this assessment yields any alarming results, it is meaningful to document the response of participants for comparison to future assessments. One thing that was discussed while I was at the senior centers that wasn't included in the report as well is that we've had a sudden influx of Amish community members in our county in actually 2 different large communities. And so there is potential that we could explore that to see if they would have year-round farming and vegetable production that we could expand for use across the rest of the population. Another concern that was expressed that wasn't in my survey questions was that we have a very limited variety of vegetables that come in for most of the season. And so some of our residents suggested that ordering in bulk through produce companies and distributing through the senior center might be a good option. To share my professional experience, I wanted to share that I had the opportunity to attend the American Public Health Association annual conference in Atlanta, Georgia this November on behalf of the Montana Public Health Association, or MPHA, and I participated in some of the student assembly events there. I really recommend this experience to anyone who has the opportunity to attend in the future. There were over 13,000 public health professionals there, and it was a really great experience. I also volunteer as the Association of Montana Public Health Officials, or AMPHO, representative to the Confluence Public Health Alliance Board of Directors. And I can't recommend enough supporting and working with Confluence in our careers, whether it's by joining a professional association like AMPO or MPHA, or through attending the annual conference in April. It's a great community and resource for us. Um, and that is it. Thank you, Lee and Hillary, and for supporting and encouraging this project. For the Madison County Senior Centers and assessment participants, and everyone watching today, especially for your patience with my technology issues. Thank you.
Nice job, Emily. Thanks.